mobilization for the hip joint to improve the flexion range. Okay, so head this side, head here, lie on the back. No, not okay. So because lower extremity is heavy, so I don't want to take whole weight by my hands. So I use this sling to support the lower extremity. So can you put your leg inside this? Okay. So my body will take care of the weight of the hip joint. So can you come little this way? Yes. Good. Relax this hand. Okay. So I need not to take care of the weight aspect of this particular joint. So now one hand will be onto the greater trochanter. You know where is greater trochanter?
Yes.
It's on the greater trochanter. And one hand will give a traction, slide down, traction, slide down and move up. Okay. Okay. So if this way, if it is working, then good. But if it is not working, if you want to provide more traction or more amount of the force, then what you have to come is you have to come from inside. How you have come from this? The inner aspect of the thigh, and again your thigh portion will provide the traction force. Can you see now? Traction force. Now one hand on the greater trochanter, slide down and move up. Okay. So this is in the initial range. Okay. The starting of the range. Now if you want to improve in the mid range, then you have to change the position. Can you bend your leg? When it comes to the middle position, you don't require this. Okay, you can do it in another position. You can remove this, but you can keep the leg on you. Okay. So now again same method. You have to give a traction outwards, traction out, and one hand on the greater trochanter. This slides down and you can move up. Okay. So traction, slide, movement should happen together. Okay. Traction, slide, movement. Okay. So after this is in the mid range. Then you can do end range. Can you bend your knee? Bend. If end range is restriction, then again traction with this hand I use for slide. Okay, and you use my body weight for the movement. Okay, so
Again.
this is in the
Again, Doctor.
greater trochanter.
Yes.
Traction, movement. Traction, movement. Traction, movement. Okay. So this will be in the initial range, mid range, and the bend your knee, end range. Okay. So this is the mobilization for hip flexion. Similarly, you can do for abduction. When you are doing for abduction, again I will take help of the sling so that I don't get any back pain. Okay, now the joint is moving like this. Okay, it's going to move like this. So traction, and with my one hand I'll slide down but move out. Okay. Can you feel the traction? Traction, slide down, movement outside. So abduction is usually 45 degrees. So you can do for all the ranges in this position itself. If this is for initial range, this will be for mid range, and this will be for end ranges. Okay. For extension, hip extension, stand up. Stand up. Stand.
Okay.
Okay? You have to be in this position. Okay? This position. Okay? With one leg like this. So I am going to improve the hip extension. Put weight on this leg. Put weight on that particular leg. Okay? Fine? Balance. Relax. Okay? So, to improve the hip extension, how much is the hip extension range? Hip extension range is how much? 10 to 15 degrees. Okay? So, this is almost neutral. Okay? So, I have to improve a little more. That's it. You are seeing this is funny, but this is very essential for your patients. Most of your patients will have hip extension restriction. At least 90% of your patient population will have hip extension restriction. Okay? So again, I may use the suspensions because it is heavy. The leg is heavy. So I don't want to take the risk. Little more. So by this itself we will get neutral position. Just from my spine itself, if I am straight, that itself will get hip extension. Just what I have to correct is the body mechanics. Can you turn this side? Turn. Excellent. So again on the greater trochanter, hand on the greater trochanter, give a traction, slide down and move up. Give a traction, slide down and move up. Okay? So this will be the extension mobilization. Okay? Relax.
Doctor, here pressure here.
Here.
Why?
Because the greater trochanter is here. Relax. Get up.
Lunch.
See the greater trochanter. This is the greater trochanter. So when I am holding the hip like this, if I keep my hand here, see, I am able to move the hip joint. If I put it here, then I may not. But if I put here, definitely I will be moving the hip joint. Okay? So that is about hip flexion, hip abduction and hip extension. So these are the 3 mobilizations we have done. Next is knee joint. You can sit down. Sit down.